Hi everyone, welcome to part 2 of our 4-part video series where we're building a mini RCM case study together. Today we're going to cover failure modes and failure effects, so let's get right to it. Failure modes. A failure mode is what specifically causes a functional failure. Typical failure modes that we encounter in our industry are things like wear, corrosion, fatigue, and so on. Failure modes are a very important step in the RCM process because we manage physical assets at the failure mode level. So failure modes should be written in enough detail so that an appropriate failure management strategy can be developed. A failure mode is like a road. A properly written failure mode puts you on the right road and sends you in the right direction. We want to go in the direction that leads us to the right proactive maintenance and default strategies. Let's take a look at what that means. Just like functions are often written as a matter of routine, the same thing often happens with failure modes. Here's an example. Electric motor fails. This is really vague and doesn't allow us to formulate a failure management strategy. A good facilitator would ask the working group this question: what specifically causes the electric motor to fail? During an RCM analysis, here are examples of what would be identified. Electric motor bearing oil deteriorates due to normal use. Electric motor intake screen clogs due to normal use. Motor bearing seal leaks due to normal use. And electric motor bearings wear due to normal use. There's a reason why this level of detail is required. Remember, failure mode should be written in enough detail so that an appropriate failure management strategy can be developed. By asking the question, what specifically causes the electric motor to fail, we were able to brainstorm more detailed failure modes. That's important because each one will lead us to a different failure management strategy that we wouldn't have arrived at if we just wrote electric motor fails. Let's take a look at what that means for these examples. For electric motor bearing oil deteriorates due to normal use, we decide to replace the electric motor bearing oil yearly. For electric motor intake screen clogs due to normal use, we clean the electric motor intake screen every month. For motor bearing seal leaks due to normal use, we inspect the motor bearing and surrounding area for evidence of leaks on rounds. And for electric motor bearings wear due to normal use, we perform vibration analysis quarterly and replace the motor bearings as required. You can see that we have arrived at 4 different failure management strategies. Now we'll move on to our case study. Let's take a training time out. In a real-world analysis, an experienced facilitator would likely lead the working group to writing several functional failures, and the failure modes we are about to write would be recorded under the appropriate one. Facilitators are trained to properly bookkeep the RCM analysis. The focus of this lesson is to write appropriate failure modes, so we're going to list them all under functional failure A. Now back to our case study. The facilitator would ask the working group, what would specifically cause us to lose our primary function? As mentioned earlier, failure modes are often written too vaguely, and initial responses would probably be something like bacteria accumulates and plaque and tartar buildup. These are not written at a level at which we can formulate an appropriate failure management strategy. So the facilitator would keep asking the working group questions and would eventually arrive at something like bacteria that leads to cavities accumulates between the teeth due to normal use, in excess of the natural part of the human oral microbiome. Food particles and plaque buildup on teeth surfaces due to normal food and drink consumption. Plaque and tartar buildup on hard-to-reach areas, gum line and between teeth due to normal use. And plaque and bacteria infiltrate tiny gaps around existing dental work and tiny cracks in teeth due to normal use. Remember that we originally started with only 2 failure modes. Bacteria accumulates on teeth and plaque and tartar buildup on teeth. In tomorrow's video, when we go over preventive maintenance tasks, you will begin to understand even more why this level of detail is required. For now, let's move on to failure effects. A failure effect is a story of what would happen if nothing were done to predict, prevent, or manage its associated failure mode. That's the key to what makes RCM a zero-based process. When we write failure effects this way, we aren't biased by any proactive maintenance we may already be doing. RCM compels us to sanity check our current practices. When we write failure effects, we record the worst case scenario. And the main reason we write failure effects is so that consequences can be assessed. Failure effects should include a description of the failure process from the occurrence of the failure mode to the functional failure, physical evidence that the failure has occurred, how it adversely affects safety and/or the environment, how it affects operational capability or the mission, specific operating restrictions as a result of the failure, secondary damage, and what must be done and how long it takes to repair the failure. Now let's go back to our case study and, using this structure, write the failure effect for our first failure mode. Bacteria that leads to cavities accumulates between the teeth due to normal use in excess of the natural part of the human oral microbiome. Within 24 hours, the bacteria starts to break down the tooth's protective enamel. At this earliest stage, the bacteria is not visible to the naked eye. Pain or other symptoms are not experienced by the patient, and the decay in this early stage may not be detectable by the dentist or X-rays. If the bacteria is left undisturbed by flossing, over a period of months, the decay progresses to the softer dentin beneath the enamel, which is detectable by the dentist using a dental explorer, which may stick in the softened tooth material. It is also detectable by X-ray. The patient may begin to experience sensitivity to hot, cold, or sweet foods due to the exposure of the more sensitive dentin. Eating and drinking may be uncomfortable. If this goes unnoticed or ignored, the decay continues and reaches the pulp. At this point, the patient is likely to experience severe pain from the inflammation and infection of the pulp, where nerves and blood vessels are located. Eating and drinking certain foods can be very uncomfortable, and poor nutrition may result. Eventually, an abscess forms, which causes the patient intense persistent pain and swelling due to the accumulation of pus. The pain may lessen as the pulp dies, but the infection remains active. Without any intervention, the tooth becomes increasingly mobile as the infection and decay compromise the supporting bone structure. The tooth may eventually fall out on its own due to a lack of support from surrounding tissues, or may require extraction to manage the infection and prevent further health complications. If the patient ignores all symptoms, the bacteria causing the tooth decay and abscess likely spread beyond the tooth to the surrounding tissues. This can lead to severe infections in the jawbone and soft tissues of the face and neck. If the bacteria enters the bloodstream, it can cause septicemia or blood poisoning, which is a life-threatening condition. The systemic infection can spread to other parts of the body, affecting organs and systems far beyond the oral cavity. Worst case, the infection is fatal. You can see that we have written our failure effect according to the structure we outlined, and you can also see that we did not just write a generic failure effect. This is a properly written failure effect. In this video, we reviewed failure modes and failure effects. Be sure to join me tomorrow for part 3, because we're going to go over failure consequences and preventive maintenance tasks. I'm Nancy Regan. Thank you for watching.